a case study on what I think is something that is small, hopefully a promising diamond on the road to more patient-centric healthcare. And it's about dermatology. And it's something we, and that's I guess why Gerard asked me for this. It's something we started from a clean sheet of paper. So we looked at how healthcare could be offered to chronic skin condition patients without taking the current healthcare structure into account. And we started it with the patient association. So that's about as patient-centric, I guess, as you can get. And also, I guess maybe to give some more disclaimers is the fact that corporations don't have the best rep when it comes to being customer focused, and this cartoon may be an example of that. But I think we do have a lot to add to the table. Having been involved in dermatology from the sideline for a number of years now, this is a call center analogy. This is the sort of thing that I do hear healthcare professionals talk about. The value of the empowered patient is there at the horizon, but to truly see the value on a day-to-day basis is yet to happen. And that's what this story is about. It's not about technology. I think technology, and Dave touched upon this as well, technology has a big role to play. This is about structuring healthcare. So here we go. But maybe before I start, and the introduction on me has been on the slide, maybe a little bit about Healthy Solutions, because Healthy Solutions is an entity solely operating in the Netherlands. There are equivalents in Germany and in the UK. It's initially a Janssen pharmaceutical spin-off. It started in the early 90s when the then managing director of Janssen in the Netherlands said, okay, Janssen, part of Johnson & Johnson, one of the broadest-based healthcare companies in the world, surely we can do more to healthcare than just supply products, hips, knees, creams, pharmaceuticals, etc. Surely we can do more. And when they started to talk about disease management. And I think in the early 90s, nobody ever heard about the term disease management. And that probably was one of the biggest challenges to overcome. Because what they started doing at that time in diabetes is to start gathering data, to look at those data, interpret it, look at what it could do for this, diabetes protocolization. Things that, I guess, today people start talking about that we need to do more of. So I guess a visionary at the time. Sadly, both internally and externally, people didn't really share the vision. So Healthy Solutions was discontinued at the time. But it started again in 2011 when we said, okay, maybe now the time is right. And let's not do it as big and beautiful as a large corporation as Johnson & Johnson wants to do things. Let's start small. Let's start in the Netherlands. And let's start in something that has a bit less complexity than the diabetes market. It centers around integrated care with a focus on optimizing outcome, and patient centricity is an important part of that. So the patients we're talking about here are, and that's why we call the initiative Skin, because it does what it says on the tin. It's about skin, and it's chronic skin patients. So people with diseases like eczema, pigment disorders, psoriasis, chronic acne, things that are from a medical, technical perspective perhaps different. Psoriasis is completely different from eczema, no doubt. I'm not an expert. But from a patient perspective, they're very similar. And when we looked at what we could do in dermatology, and we sat down in focus groups, and we looked and we read all the publications, and we went to all the conferences, and we really took a deep dive in what the patient perspective on this is. We saw that there are a lot of similarities, and there are a lot of things that we could do to help. Because we're talking about a big group of patients. If you add all those conditions up, it's about 15% of the population has these conditions, and about half of them actually go and see a doctor for it once a year, at least. And that's over 1 million patients in the Netherlands only. And it's a chronic disease, more chronic than diabetes will ever be, because 80% of the diabetics are over 50. these are diseases that start, or conditions that start when people are still young. Maybe they're not as severe throughout a person's lifetime because they come and go with seasons or periods of stress, but they are impactful, and often they're incurable. So it's a disease category where, as a physician, you should not just look at getting rid of the red stain, but also look at how people can cope with having such a disease. And that's why it's so surprising that in the current treatment protocols and pathways and the way GPs and dermatologists go about their treatment in dermatology, there's still relatively little focus on quality of life and measuring quality of life in the current standard of care. And because that is the case, patients start shopping, because if, and maybe in that respect, skin is different from cancer. You don't die of a skin disease, well, not these skin conditions anyway, but it does bug you a lot. So if your current physician doesn't offer you what you're looking for, you start looking elsewhere. You start going to an acupuncture doctor. You start going to another dermatologist. You may even go to a Chinese herbal expert to see if he or she can do something about it. So they start shopping around, and if you start shopping around, and this ties into Dave's story as well, it would be useful to have a little bit of insight into what the quality and cost of the various options are. But there is no insight into the cost and quality of the various options there are. What we did find is that if you add all these conditions up, the budget impact for the reimbursed care in the Netherlands is over 400 million. So individually, these conditions are not super expensive, but collectively, over 400 million is a lot of money, and thus at least a hint that maybe large healthcare insurance companies could be interested, and also that these patients spend about the same amount of money per a year on non-reimbursed healthcare. So it's a different type of healthcare, I guess, than standard. So what did we say we could do about that? We designed something which we called SKIN, which we believe is integrated healthcare, and there's various definitions of integrated healthcare, because we combined three things in an attempt to create the physical Google for the chronic skin patient. The three components are healthy skin, and healthy skin is all what is offered under the existing healthcare reimbursement system in the Netherlands. So consultations and treatments by GP, dermatologist, pharmacist, some paramedics like a skin therapist, and perhaps even a psychologist with an interest in dermatology. That treatment, of course, is traditionally based on treatment guidelines. So what we did is, if you assume that healthcare is not offered partly in a primary care center by a GP and partly in a hospital by a dermatologist, but in a multidisciplinary setting, what would the optimal way through the process of anamnesis, diagnosis, treatment, and follow-up be if all the relevant professionals are on board? So a nurse, a GP, a dermatologist, everybody is there at the table. And if you have all those people on board, and if you are able to rearrange tasks in the treatment pathway, that's when you start seeing where the opportunities for instant quality of care improvement are. Because imagine that one of the reasons why skin condition patients are so frustrated is that their GP, although for a GP, one of the largest volumes of his practice is dermatology, for him or her, it's very challenging to instantly get to the right diagnosis. Whereas a dermatologist says, I've studied for 5 years extra to, well, all I do is, well, that's not entirely true, but what they say is, we're very good at diagnostics, but only 10% of patients reach me. So if we can get the dermatologist right in front of the treatment pathway and then let a nurse or a GP do the rest, then you have a better outcome. You get to the issue much quicker, and you save cost, theoretically. So that's healthy skin. And because we saw that apart from healthy skin, these people are also looking for other things in the healthcare arena. We said we should complement it with better skin and beautiful skin. And better skin, you have to imagine things that are disease-related but paid for out of pocket. So maybe a camouflage treatment by a skin therapist for somebody who has vitiligo, a pigment disorder. And beautiful skin is the fact that somebody with a skin condition also has wants and needs when it comes to having a good day cream that is suitable for somebody with a sensitive skin. Now that product offering should offer that physical Google for chronic skin condition patients, which of course is not applicable to everybody who enters into a skin center, but at least part of it will be. So how does it work in practice? Because it's of course a very highly theoretical model thus far. If you look at the way, and I probably don't have to explain this to you, but maybe then for the benefit of Dave, currently the healthcare system of course works. People go to a GP first, primary care. So those 1.2 million skin disease patients in the Netherlands go to see a GP first. He or she does his or her utmost to avoid the patient progressing to secondary care. So only if needed you go to see a dermatologist. That's about 15%. So what we said is, can we find a way where we combine a GP and a dermatologist, a nurse, a skin therapist, a psychologist, and a pharmacy in one physical location, which you can do, of course, in this day and age, because primary care centers have everything that you need for that structure, except for the dermatologist. So if you can get that dermatologist to go and work in a primary care center, and not just work there, but become part of the structure, become part of the shareholders of such an initiative, then you truly have joint accountability and responsibility for something that is between primary and secondary care, and something that I guess in the Netherlands we start calling anderhalve lijn zorg. And in this location, which you have to imagine is in a typical primary care center, and we're working in the Rotterdam area with a center that has all those disciplines there on board, with a catchment area of about 25 to 30,000 people, where people go, what we here call skin consumers, people who don't have a skin condition, but are looking for something that's there for them to get, and people who were traditionally in primary and secondary care. And in that skin center, the team operates according to that treatment protocol, which has a very clear structure when it comes to medical and quality of life outcomes, which is very structured when it comes to who is treated monodisciplinary, who is treated multidisciplinary. But what is a protocol that is not a protocol, as you do in diabetes, you have to have 3 times a year, you have to do a check, you have to do a scan, you have to do this. Now, to get to that outcome, people can go this way or they can go that way, because everybody who can help them is there on board. That sounds when we started doing it, we thought, that sounds like a no-brainer. That surely people have thought of this, and of course there have been dermatologists who do consultations in primary care centers, and it's often ends very quickly because the GP tends to dump a lot of his work onto a dermatologist, and the dermatologist then thinks, this is not what I was educated for. I'm here to do the complex things, not the simple things. And insurance companies say, this is not exactly what we wanted, because the dermatologist is only there to refer people to his hospital. But in this integrated setting with shared control of a skin location, you do, I think, have a win-win for key stakeholders, and first and foremost patients, because it's integrated care closer to home for sometimes very severe conditions. It's an opportunity for healthcare professionals to bury the hatchet, is perhaps a way of putting it, between primary and secondary care physicians. It's an opportunity to cooperate with a focus on quality and service. And it is an opportunity, because they are shared owners of the actual skin facilities, to work with a better outcome, is a better reward, is a higher reward structure. Because one of the key aspects of the reimbursed healthcare product offering is the integrated fee that we charge for it. So I think what people a few years ago wanted to call ketenzorg, integrated reimbursement, and what perhaps now is more transitioning towards population or capitation financing, that allows owners of the actual skin location to work in a way that if they have to do what's right, because the protocol is transparent and the outcomes are transparent, and if you don't help these patients properly, they'll come back, and that will cost even more. But you won't do more than you absolutely need. So you won't fire away with expensive treatments or an enormous amount of consultations or products that cost more, because that ultimately goes at the expense of your own bottom line. For payers, although skeptical at first, I think they've come on board because it offers a way to centrally contract something that is far from transparent now, because it's a very scattered healthcare landscape. This is an opportunity to close a deal with one party in one postcode area for one fee for a subpopulation of their clientele. And for policymakers or the government, it's maybe not a big initiative, but it's an initiative that is a direct translation of what they set out to do, which is give the patient a prominent role in the protocol, because one of the parties in the skin treatment protocol actually is a patient. It's substitution from secondary to primary care, and it's integrated financing on a population level to delegate risks for overtreatment and increasing costs. We started working on this. So the first sketches with the Patient Association were in 2010, early 2011, and it's taken a long time to get where we currently are, because it's about securing support in the healthcare arena, because it is a new way of offering healthcare, which needs an innovative way of financing and contracting. It was new to the Dermatology Association. It was new to the primary care organizations that have a say in this. But we are currently at a stage where the major payers have at least expressed a willingness to contract, where in several locations we have the primary and secondary care partners we need to actually get this done. And we're on track to start in Rotterdam on the 1st of January in 2014. Now, I appreciate that this is a story that goes a little bit beyond what patient centricity and patient engagement is about. And I guess the main thing for us is the fact that everything started with the patient, and because in the treatment protocol the patient has such a prominent role in determining the path he or she takes throughout the treatment pathway, it is something that should ooze the fact that this is transitioning towards patient-centric care. And it ticks a few of the boxes that I guess people want ticked when it comes to healthcare innovation, because it shifts care to community. And how great is it if you have to go and see a doctor a number of times a year that you can do that close to home, in the primary care center you're used to going to, that has extended opening hours on a Thursday night and a Saturday morning. How great it is if you have a say in if you actually want to go and see a dermatologist or a GP or maybe a skin therapist for your condition. And how great, well, not great perhaps, but how useful is it that in a future when maybe the basic healthcare insurance package is decreased, eczema is one of the things that people expect to be kicked out of the reimbursed package. How useful is it to be able to go to a place where there's a consistency of a treatment team, because you can't just go there for reimbursed healthcare, you can also go there for everything else that you need. And that's, in my or our humble opinion, what, in a very small way, patient-centric healthcare could look like, and what we, as Healthy Solutions, will strive to upscale in the Netherlands in dermatology and perhaps beyond. So that's it. Thank you.